Dr. Chirag Kotecha at Refined Skin and Body Clinic. Very happy to introduce our newest addition to your weight loss journey, which is the Allurion program. This is a swallowable balloon that can help you lose weight up to 15 to 20% of your body weight over a period of 4 to 6 months. And depending on your lifestyle habits and continuity after, you can keep that weight off. So if you have issues with weight, have painful knees, painful back, suffer from diabetes or blood pressure due to weight, this could be a program for you. If you fail dieting, find it difficult to exercise and need a physical restriction to your food intake, and surgery is far-fetched for you, you can consider this option, which is the Allurion program. We're going to talk about it today. We have Mr. Mika here from Nairobi, who's going to take us through the demo program of it, and you can come in anytime to discuss this in detail. Thank you.
Thank you so much, Daktari. So my name is Mika. I am the program manager for Allurion in Kenya. And today we are going to be demonstrating the procedure of placing the balloon inside the body. So prior to the placement, we normally do a preparation for about 5 to 14 days of PPIs just to keep your acidity levels low. Then you have to fast for about 8 hours before the placement, so that we can do it comfortably without getting a lot of feedback. Now, this is the size of the capsule before we expand it to complete size. Now, during the placement procedure, we will give you 3 trials. So we will place it in your hand, and then we will give you a cup of water. We will instruct you to place it at the back of the mouth, like so. And then you will drink water to assist you swallowing it. If by the 3rd trial you can't do it, we will move forward to assist you by stiffening the catheter so that we can assist you swallowing. We move according to the motion of the muscles, allowing you to swallow food. Remember, we swallow bigger volumes of food than this. This is actually a very small pill. You can even see it in comparison to my finger. It is very, very possible to take it in. Now, after you have successfully taken in the pill, we observe up to the 3rd mark. So when the 3rd mark is just here outside the mouth, we know the capsule is inside the stomach. Then we proceed to do our first imaging, which is an X-ray, to observe the capsule, to confirm it is in the right position. Once we confirm that, we proceed to expand the balloon out of the capsule to full size. We use water from the company, and we will use a filler bag to deliver the water into the capsule at a constant pressure so that it expands within a short period of time, and then it also gets to full size. After we have done the expansion of the balloon, we move to the 2nd image, whereby we confirm the balloon is seated comfortably inside the stomach. Now, this is the full balloon, and let's say my hands are the stomach walls. They just caress around the balloon and hold it in position. Once we confirm the 2nd image, an X-ray, we proceed to detach the catheter. And then that's it. The balloon is already in place and your journey to weight loss has begun. The Allurion program is a completely non-endoscopic, non-surgical, and non-invasive procedure. And the balloon stays in your body for 16 weeks, give or take 2 weeks. Now, when the balloon has undergone its full cycle, it does what we call auto-release. This is a valve that self-releases to let the water inside the balloon spill into the stomach and pass out naturally. This water is not just normal tap water. It's not even normal saline that we use in hospital. It is special water prepared by the company that has even food-grade preservatives to make sure it does not go stale inside the stomach. So when you're passing out the balloon, it just passes out like normal stool, and once it is out, you will notice, because you will even feel a bit of relief in your stomach. But anytime you try to do the overconsumption, there is what we call the phantom limb effect or the phantom balloon effect. You feel fuller faster.
That's something that people ask, that once this balloon or the physical barrier goes out, will I not go put on weight? I'll start eating again. But one thing that Mika said was about the phantom effect, and secondly, if you think about your stomach, it's a muscle. Now, over time, you've been overeating, mostly for people who are overweight. This muscle has expanded. After this activity, the muscle is sort of relaxed and gone back to its natural position. So yes, if you do go back to eating and forcing yourself to overeat that KFC and unhealthy food over time, that stomach will expand again. And you'll put on the weight over time. It will take a long time. But if you listen to your body and observe that effect, that restriction is still there, that muscle is small, your food intake is reduced, you should keep off that weight. I think statistics show overnight. What is the statistics that are there?
So post-balloon passage, people keep off 95% of the weight they lost. The 5% regained can be accredited to water gain or a bit of muscle gain, depending on the activity the person is doing. Plus, you also experience a bit of exchange, loss of body fat, gaining of muscle. That's when we get the tonnage. You find someone shrinking in body size. Size 18 to a size 16, size 16 to a size 14, 14 to a 12, and so forth. Reduction in body size. Now, what Dr. has said is very true. This is not a magic solution. You have to still put in the work to make sure you change your habits, you change your behavior, and you change your relationship with food to improve for the better.
At Refine, as you may know, we have got various medical weight loss programs which rely on multiple tablets and injections to be taken. However, for some people, due to their lifestyle or psychology, are not able to commit to that. They go into, myself included, we've tried the weight loss programs, and then we need something physical to restrict our intake. I'm a foodie, I like my food. When I eat, I can eat a large quantity of food. So for me, the dieting and the exercise proved to be very difficult to keep my weight off. So programs such as the Allurion balloon, where you've got this sitting inside your stomach for several months, restricts your food intake. Now, combine that with the other weight loss programs and exercise, will help you lose weight further, make you be healthier. So it's a short-term sacrifice, swallowing a balloon like this, rather than having long-term complications of diabetes, blood pressure, knee pain, back pain. At Refine, we also have a plastic surgeon who comes in and offers plastic surgery or bariatric surgery. We call gastric sleeve or gastric bypass surgeries. Now, these are more extensive, more advanced. If you're not ready for that and you want something in between, this is where the Allurion balloon comes in. This is a worldwide recognized treatment, FDA approved, and has a lot of benefits, helped a lot of people. In Kenya, you've done over several hundred placements, I believe, already?
Yes.
In Uganda, we're the first, so tomorrow we'll be doing our first case. We're very proud as Refine Skin and Body Clinic to be the pioneers of the Allurion balloon in Uganda. We're happy with Mika and his team from Nairobi to agree to partner with us on this, and we look forward to helping you. So if you want to discuss it further, call us on 0758 232 889 to have a consultation, no obligations. We can discuss it and prepare you for what could be a healthier you, a healthier journey to a lighter person. Thank you.
The Allurion program has been in active status in the world since 2007. It is world renowned, recognized from the UK to the Arab Emirates to the US, and it has good results. The scientific community has data upon data to support its validity and even its effectiveness in management of weight.